Well, okay, hello everybody, and welcome once again to another one of our In Conversations, part of the series we've been doing, looking at the work of the NIHR, the National Institute for Health Research. I'm delighted to be joined today by Louise Wood, Dr. Louise Wood, who is from the Department of Health and Social Care, where she's Director of Science, Research and Evidence, and is also the Deputy Chief Executive of the National Institute for Health Research. Louise, thanks so much for joining us today. Look, a lot of people listening, watching this will know you. A lot of people possibly won't. So it's always interesting. I always ask people, just tell us a little bit about your background and how you got into this particular role.
Okay, and good to be here, Richard, and hi to everyone who's joining. So I'm a biomedical scientist by background, PhD, physiologist. I joined what was then the Department of Health in 2005. To work with Sally Davis when she came in and was working to establish the National Institute for Health Research, NIHR. So I've been there since the beginning. I've had a number of different roles in R&D, including leading on relations with the life sciences industry. So that was in particular at the time the recommendations from the Healthcare Industries Task Force. Remember HITIF?
I do, yes.
Taking us back, isn't it? Yeah. So that was one of my roles. I also spent a bit of time on secondment with the Association of Medical Research Charities as their Director of Policy and Public Affairs. Prior to joining the department, I spent a number of years at the MHRA, so 4 years on the board at MHRA, and had a variety of different jobs there. So I worked in drug safety, I worked on international projects looking at electronic standards for the transfer of regulatory data. And then the last job I had there was as director of what was then the GP research database, where we're collecting data on about 5% of the UK population. And it's used for a variety of different public health research studies. And I had a small research team that did commission research for industry. So I've got quite a lot of contact with industry through my career, although never actually worked in industry.
Well, that's great, and obviously we've spent a lot of time together over the years. I think you've touched on just in that introduction about your background here, just the sort of complexity and the wealth of things are out there. And I think people perhaps come into this, or people trying to figure out how they can best interact with the research establishment and all the different bits of it can find that quite daunting. So it was great you were there at the very start of NIHR. If you can, as simply as you can, I know it's not simple, can you tell us what the institute is, what it aims to do, and how it goes about it?
Yeah, sure. So we were established in 2006 with a mission of improving the health and wealth of the nation through research. So we've had working effectively with industry as part of our DNA since day one, although obviously, it's taking time, I think, to get culture change in the health and care sector. But essentially, we discharge our role through 6 core functions. So one is we fund high quality research to benefit the NHS, public health and social care. Secondly, we fund world-class facilities and expertise and a skill delivery workforce to help translate discoveries into improved treatments and services for patients and service users. So that includes supporting research that's funded by life sciences industry, medical research charities, as well as ourselves and other government funders. Thirdly, we place a lot of emphasis on partnering with patients, carers, and members of the public at all stages of the research journey to really ensure that we improve the relevance and quality and impact of our research. Fourthly, we are UK's biggest funder of clinical academic training. So we support the training of doctors and dentists and nurses and so on who want to pursue a research career, as well as a wide range of allied health professionals and methodologists. We obviously work across the ecosystem with industry, with BAYS and others to try and ensure that we've got a competitive research ecosystem. And then last but not least, we have official development assistance funding to support research and training to benefit people living in low and middle income countries. So essentially we fund research, we fund people to support the research that we fund and others fund, and we support training of research professionals. That's what we do.
Right, and give us a sense, Louise, if you can, of the scale of the institute itself, and maybe there's sums involved in the sort of funding you're responsible for distributing.
Yeah, so we've got an annual budget of about £1.3 billion a year. So sizable budget, yeah.
That's great. I mean, for someone you like yourself with your background, this must be your dream job actually to oversee all the amazing things that go on.
It's a tremendous privilege, and every time I go out, it really refreshes, rejuvenates me, because you see when you talk to patients, you see the impact that it's having on them. When you talk to career, whether they're professors or people doing a PhD, just the impact that our funding's having. Yeah, I'm super lucky to have this job. I must say, yeah.
That's great. It's great. I think you're the right person for it as well. And what I will say to people watching again, I mean, you've explained that very, very lucidly. They should also watch the other one of these conversation series with James Richards, who heads up the National Office for Clinical Research Infrastructure, which I have to say is one of the wonders of the world. I'm exposed to it regularly. Well, about every couple of years, I get the full NIHR download, and I always go, wow, I'd forgotten how good this was. And it really is it's the highest quality signposting you'll see anywhere. So if people want to try and boil down and find out how they reach the right part of the Institute, then NIHR is the place to start. So maybe finally, Louise, maybe just tell us a little bit about, we're recording this, well, we've wished each other Happy New Year, haven't we? It's the first week of January 2022, somehow. Tell us a little bit about your priorities over the next year or so.
Yeah, so I'd identify maybe sort of 5 areas of particular focus. So firstly, helping the health and care system really have the evidence to respond to the continuing pandemic, but also to recover from it. So we're still funding some research, for instance, on therapeutics, the panoramic trial on antivirals, some work on vaccines, but also thinking about how do we help the NHS address the huge backlogs that it has. And I know that's something that ABHI and your members are really giving thought to. And how do we enable the clinical research to recover, become more resilient, learning from the COVID experience and grow. Secondly, we are looking at how we can build capability and capacity in preventive health research, social care research and public health research. They've been kind of underserved in the past, and that includes research on mental health, and also how we help the more than 14 million people living in the UK with multiple long-term conditions. They're all areas that have been underserved. We want to ensure that the research that we fund and the research that we support, that industry and others are funding, is more diverse and inclusive than it has been to date. It's relatively easy for people to work with the researchers that they know or who live down the road. We want to get to the parts that haven't been reached before, and we've got infrastructure across the country that can enable that. But we know that we need to do better in terms of the communities to reach through that in the past have not participated in research for a whole variety of reasons. Next would be our work with our colleagues in the Office for Life Sciences and Accelerated Access Collaborative to really look on delivery of the life sciences vision. So we've got a number of elements in that we're responsible for, but we're also looking at how we improve our offer to the life sciences industries. So that includes work on our Invention for Innovation programme. Mike Lewis, I think, is going to feature in another of these podcasts. We continue to evolve that scheme as the environment evolves, and that's aimed at your industries, big and small. Martin Hunt, the previous director of the I4I programme, is leading some work specifically to look at how we can better engage with SMEs. You mentioned NOCRI earlier on. We don't want people to feel they've got to understand the acronym soup. We want people to be able to come with their ask and us to find investigators and collaborators to help. But we need to work with the HSNs and others to really reach through into the communities where SMEs are active. And then we're looking at the infrastructure that we have to support the health tech industry. So, Richard, you and I have spoken at a number of events of our medtech and in vitro diagnostics cooperatives. They've been very successful in working with industry, but the feedback we've had from industry is about how we can better expand the scope as well as the resourcing of that infrastructure. And then lastly, last year we published Best Research for Best Health, the next chapter, and that really articulates the key areas of strategic focus for NIHR over the next 5 to 10 years. So also looking at how we put the foundations in to deliver on that. So a full agenda as always.
What really strikes me, Louise, listening to that is just how applied all that is and how relevant it is to the challenges that the NHS face. And it's really great to see how grounded the research infrastructure is. Easy to think about research being stuff that's buried away in universities somewhere, isn't it?
Yeah.
And perhaps we have to come up with another name for it. I don't know. If you have one message, without wishing to be trite, but a message for the companies listening to, watching this, and the role they can play in the research agenda, what would it be?
So I think there are people ready and willing to help you to discharge your research agenda. My ask of the sector is that you listen to what the research needs of the health and care sector are. It makes good business sense to develop products that are going to meet a need, and NIHR plays a really important role in the interface between clinicians and patients and the social care system and companies. So we can help you find that sweet spot that's going to deliver for our community, but also is going to deliver a commercial product for you.
That's great. That was great advice, Louise. So what I want, the needs-based selling. Listen to what you've just said. It's great. Louise, it's been an absolute pleasure. Thanks so much for finding the time to be with us today. And we look forward to continuing to work with you and all your colleagues across the NIHR. And thanks so much for what you do on our behalf.
Thanks very much. Bye for now, Richard.